Hello. This is Dr. Nima Aghaebrahim. I am a stroke neurologist and a neurovascular surgeon, and I am calling you today with this video to discuss stroke and stroke risk factors. So I appreciate you connecting. If you stay tuned, I'll be starting in just a few minutes. Okay, so sorry about the delay, but we're back. So again, as I said, I'm Dr. Nima Aghaebrahim, and today I'm going to be talking to you about strokes and stroke risk factors. Thanks for tuning in. I believe if you have any questions, please feel free to ask them on the comments, and we will answer you as soon as we can read the comments. So what is a stroke? Well, sudden loss of brain function due to a problem with a blood vessel can cause deficits, and that is called a stroke. Stroke is a medical emergency, and it is a #1 cause of disability. So it's very important to know the signs and symptoms of stroke, and know that the treatment are available, and also know how to prevent stroke. So this is what we're going to be talking about. So what are the types of stroke? Well, there are different types of stroke. The main two kinds are bleeding stroke or a hemorrhagic, which called a hemorrhagic stroke, or ischemic stroke, which is caused by a blockage in one of the blood vessels. Hemorrhagic stroke is the one that causes bleeding. So we have blood vessel in the brain, due to certain reasons, can burst, and that can bleed, which causes problem. So what are the causes of bleeding? Well, you can have an aneurysm. Brain aneurysm is very common, especially among certain patients with certain genetic disorder or different risk factors. And a brain aneurysm is like an outpatching of a blood vessel, which can burst and can cause a lot of disability and significant morbidity. Other things that can cause bleeding in the brain, we have a little blood vessel in the brain that can burst due to high blood pressure, for example, smoking, diabetes. There are other kinds of bleeding stroke, but today I'm mostly going to be talking about ischemic stroke. So what are the types of ischemic strokes? Here's, for example, a picture of a brain, and as you see, the brain is round, it's in the skull. If you look inside or around the brain, you see all these white, these are all the tubes that carry blood to the brain. If there's a blockage in one of these blood vessels, that can damage that part of the brain, and that damage is called stroke. If you look inside the brain, these blood vessels are different. There's some big blood vessels that go here, for example. There are some smaller ones that go here. So the types of strokes are as follows. There's what we call a small vessel disease. So these little blood vessels that run inside the brain sometimes can thicken and then block off. Main risk factor for those are blood pressure, diabetes, high blood pressure, diabetes, high cholesterol, smoking, poor lifestyle, and the treatment for that is usually acute treatment, again, which we talk about it, but prevention would be really control the risk factors. The big blood vessels also can be blocked due to, again, atherosclerotic disease, but also sometimes the heart can throw a blood clot. The blood clot travels and it gets stuck right here, and that can cause a larger stroke. That can be prevented, but also can be treated if you can get there soon. So I'll be talking about that as well. There are different kind of strokes. Sometimes you can have a blood vessel here that can get disease over time, and that can shut off. And there are sometimes blockage in the carotid arteries or vertebral arteries that can also throw a blood clot in the brain that can cause a stroke. So all those are some of the big risk factor for or a stroke, cause of stroke or ischemic stroke. One thing that's very important and you need to know, and everybody needs to know, is time is brain. Every minute that passes when this blockage forms, about 2 million neurons can die, and every minute counts. We have studies, looking at the stroke patients. We know that if you have a stroke and treatment is delayed by 15 minutes, for example, there is significant chance of a recovery independence. So bottom line, time is brain, and therefore when a stroke happens, it's very important again to call 911 to seek treatment as soon as possible. When stroke happens, usually the ischemic kind doesn't cause pain. Usually presents as weakness or numbness on one side of the body. So if blockage happens in, for example, left side of the brain, that can control speech or movement of the right arm and leg. So if a blockage goes to the left side of the brain, then patients can have difficulty speaking. That can be a sign of stroke. So we use an acronym that's called F.A.S.T that can be remembered to remember signs of stroke. Bottom line is a sudden loss of function on one side of the body in a right setting usually is a stroke. So let's go through the F.A.S.T. B stands for balance. So if all of a sudden balance is off, or eyes, E stands for eyes, or if you cannot see, and those are signs of stroke. The F.A.S.T, F stands for facial droop. So if you have one part of the face gets droopy, it could be a stroke from the other side of the brain. And A stands for arm. So usually ask the patient, hold your arms up like this, and if one arm drifts down or cannot lift up one arm, all of a sudden that can be a stroke. S stands for speech, so if you cannot speak, that can be stroke. And T stands for time, because time is very important when it comes to stroke. So be fast, again, if you have a stroke, be fast, but also know the signs and symptoms of stroke. So those are the signs and symptoms of stroke. How do we approach stroke? Well, the way I look at it is there are primary prevention of strokes. Those are the things that everybody can do to prevent a stroke, similar as a heart attack, to form. Those are the healthy lifestyle, looking at the risk factors. Those are the things that we all should be doing. Then when a stroke happens, then there's treatment available right away. So then those are the patients that need to call 911, come to the emergency room, come to the hospital, get treated. Then after the initial stroke that happens, then we talk about secondary prevention. So let's go through those. Primary prevention. This is what we should focus on. Healthy lifestyle. What are they? Well, exercise often, eat healthy, know your risk of stroke. I believe we will be sending out a cardiovascular risk card. Everybody can go through that and know your risks and talk to your primary care doctor. If your blood pressure runs high, well, that's a risk. We need to control those. If your cholesterol is high, if you're smoking, you should stop smoking. Diabetes. Exercise is very important in my opinion. The recommendation is about 30 minutes of routine exercise every day. That doesn't mean anything too crazy, but just a fast walk where your heart rate goes up a little bit for 30 minutes each day at least is very important. Exercise helps with decreasing cardiovascular risk factors, losing blood vessels, helps with memory, helps with a lot of different things. Eating healthy also is very important. Eating, less fried food and healthier lifestyle, eating vegetable and fruits is very important. Then it goes to avoid smoking, and then it goes to, with your primary care doctor and your cardiologist or stroke doctor or whoever you have to talk about, what are my risks? Do I have high blood pressure? Well, then that has to be controlled. Do you have any heart condition? That has to be controlled. Those are the primary prevention. But despite of all that, unfortunately, people do have stroke. By the way, stroke can happen at any age, anybody. When stroke happens, that F.A.S.T part, Then remember I told you one part of the body usually gets weak, but doesn't hurt usually. Then people say, well, for example, my arm is not working as good, let me just wait it out. Or people are at home alone and they cannot speak, they may not get to the phone. Unfortunately, in this era, in this time, sometimes people are not together, so some strokes may go unrecognized. So that's the problem, because then they're delaying acute care. I think if anybody has a family member or friends who are high risk of stroke, if you can check on them via FaceTime or whatever, and if you notice sign of a stroke in somebody, or somebody notices that they have a sign of stroke, call 911. When 911 is called, obviously EMS is equipped to attend to the emergency, which stroke is. They know what to do, where to take the patients. Not all the hospitals are equal, so it's important again to go to the hospital that provides the care and the right care for strokes. And thankfully, for example, in Baptist, we have developed and worked hard. We have a great team that attends to acute strokes. So you have a stroke, you call 911, you go to the hospital. What happens in the hospital? Well, you get evaluated to see what the signs and symptoms are. In our hospital, for example, I am very proud to tell you, when EMS is coming to the hospital, they send us a message and say, hey, I have a stroke patient coming. That helps the ER to get ready. That message goes to the stroke neurologist, the OR team, so everybody knows that, okay, there's a stroke coming, so everybody can get ready. Why is that important? Well, time is very important, right? So when you come to the hospital, if we know that there's a patient coming to the hospital, we get ready to provide the care. So when you come to the stroke, when we come to the hospital, what is the flow? Well, we have a dedicated location where the stroke patients go initially. They get evaluated quickly, make sure stable, and then they go to a CAT scan right away. Why do you go to CAT scan? Well, stroke, as I told you at the beginning, are bleeding kind and non-bleeding kind, so we need to get a CAT scan to see if it's a bleeding or non-bleeding. After assessment, make sure it's stable. We also check glucose, for example. Then we get a scan, and based on that, and based on the evaluation, and based on the time that the stroke happened, there's a drug that can be given. It's called TPA, or a clot-busting medication. It's done through the IV, goes through the body, and it helps dissolve the clot. This, by the way, was proved in 1995, so it's a long time. The problem with that is it's time sensitive, so we can only give it up to 4.5 hours. So that's the time window. Sooner that's given, better it is, but up to 4.5 hours it can be given. Certain patients who may be taking blood thinner may not be able to get it, but anyway, there's a checklist that has to be gone through. Make sure it's not a bleeding stroke and make sure there's no risk, then that drug is given. After the drug is given, or while we're getting the information, patient also get 2 more studies. The most important of them is a CT angiogram. So that's a study that looks at the blood vessel. So the CAT scan that we do looks at the brain. Slice it like this in different ways and see if there's any blood in the brain. The CT angiogram is a study that looks at the blood vessel, because remember we talked about different blood vessels can be blocked. So the CTA will tell us if there's a blockage. Why is that important? Well, other than TPA, there is one more very powerful treatment available. It's called thrombectomy. What does that mean? Well, if you have a blockage in one of the main blood vessels, the chance of a good outcome from that is low if that blood vessel remains blocked. Let me rephrase. If somebody throws a blood clot and block one of the main arteries, then the part of the brain can get damaged, and if that blockage remains. So we have tools that are available where we can go in and remove that blockage, and that's called thrombectomy. Again, in Baptist, I'm proud that we have a great team in OR, in the ER, and in ICU and everywhere else, who can provide this care where we can do this as fast as possible, because similar to TPA, time again is very important. And obviously this procedure also has to be done appropriately. You have to be able to remove the clot, for example, fully to perfuse the brain. Let me show you a picture, for example. So just going through the flow. So in an emergency room, you get CAT scan. You may get the TPA, may not get the TPA. You get a CT angiogram, and if there's a blockage, then you're taken right away to the angio suite or operating room, where we all work together. We have anesthesia there, and we make sure that safely put on a table. Then we prep, and usually we go through the leg. Rarely we can go through the wrist, but usually we go through the leg. The leg, you have a straight shot. We can put a tube and catheters, and then goes through the arteries, and we can inject dye to see where we're going. Once we see the blockage, if there's a blockage, then we go through the blockage. Thankfully, we have great technology where we can do that pretty fast and pretty effectively. For example, this is an example of one of the tubes. You see it's pretty soft. These are small blood vessels that we deal with. Due to different method, this tube is navigated, and it goes up to the middle cerebral artery, for example. And there's smaller tube that goes through the clot, and then there are different techniques, but one technique is we can deploy this device. It's called stent retriever. It's a very soft material, and we can deploy this. As you can see, it's connected to the wire, so we can deploy or open this up inside the clot. It's very good to attract the clot, and with this tube, then we take this tube into the clot, and while we're aspirating, we remove this, and with this, usually the clot comes out, and we remove it out of the body. So the stent is not remained in the body, but helps to remove the clot. Again, there are different techniques, but this is one example where the clot can be removed. This procedure has to be done fast, effectively, and but it's very powerful. It leads to significant chance of a better recovery from a stroke. So it's very important to be able to get this treatment for appropriate patients when able to. Once that's done, then the patient goes from the OR. Usually you may get a CAT scan to see how things looking, but then go to the neuro ICU. We have a great neuro ICU. We have a great neuro ICU team who attend to these patients, because when you open up blockage now, there are risks, bleeding and other things that can happen. So the ICU cares for that. Then we have secondary prevention, why this happened, try to prevent it from happening by different medications, and then physical therapy, occupational therapy. The nurses do a great job of caring for these patients. Try to look for complications, and then discharge to rehab, maybe home, and at that point, again, we will look for secondary prevention. So that was really the flow of a patient who may go get a thrombectomy or clot busting medication. If sometimes you may not need both of those or may not need any of them, you still get admitted to the hospital for the stroke workup. That's different things that are tested. But that's usually the acute stroke. So just to emphasize, when a stroke happens, call 911, have to take into appropriate place. There's acute treatment available for some people, and it's very, very powerful. And then there's a care that has to be given. Stroke is an emergency, and that was the flow. So what happens after stroke happens? Well, once patients recover or during the recovery, it's very important to focus on secondary prevention. What does that mean? So remember, we're talking about primary prevention, then we're talking about secondary prevention. To know the secondary prevention, you need to know the cause of the stroke. So remember, I told you there's a little blood vessel that can get blocked, or big blockage. We need to know where that blood clot, for example, came from, and then try to prevent that from happening again. For that, we usually look at the heart, we look at the arteries in the neck, we do some blood work, and we go through the risks. The risks are similar to primary, but there are a few things that are very important. There's certain risk of stroke that we cannot control. There's some genetic risk factors, age, gender. These are the things that we cannot control. We need to know about them. But there's some things that we can control. So let's go through them. All of our stroke patients that come to clinic, they do get a handout similar to this, and I usually go through the risk factors with them. That way they can know the risk of the strokes. This handout talks about what the stroke is, and then this page right here talks about what are my personal risk factors for a stroke. Well, as I discussed, the things that are very important is high blood pressure, for example. The higher blood pressure over time can harden blood vessels, can cause a problem. Usually we tell the patient that your upper number blood pressure needs to be less than 140. If the blood pressure is more than 135, that's considered high blood pressure currently. I usually advise them to work with medication, lifestyle to decrease it less than 135, that upper number. Next thing is cholesterol. You need to know different cholesterol measurements. So when we check cholesterol, there are different parts. There are total cholesterol, there's good cholesterol, there's bad cholesterol. The bad cholesterols are the LDL and the triglyceride. And those numbers need to be a goal to prevent these blockage from forming. And it depends on what your cholesterol is. So I advise if anybody has had a stroke or heart attack or any cardiovascular disease, to talk to your primary or whoever doctor that you have and know your cholesterol numbers and know what your goal is. After cholesterol, I think diabetes is one of the other ones that are very important. With time, the high sugar again can harden blood vessel, so getting the diabetes under good control is very, very important. You need to know your A1C, so you need to know your blood pressure, you need to know your cholesterol, not just total cholesterol, but the LDL and triglyceride. By the way, the HDL is a good cholesterol, and then you need to know your A1C when it comes to diabetes. After that, smoking is very important. Smoking can cause, again, cardiovascular risk factors. By the way, earlier we talked about aneurysm. Smoking and high blood pressure are risk factor that can be modified for aneurysm because they can lead to aneurysm or aneurysm growth. Then we have certain heart condition that can cause stroke. It's very important to know your heart disease and your risks. There's a very common condition called atrial fibrillation. So the heart has 4 chambers. The upper chamber sometimes may beat irregularly, and it might be all the time, maybe sometimes. And depending on what that beating, how is the rhythm is, it can be a condition that's called atrial fibrillation. When that happens, a clot can form at the upper chamber of the heart. Then that can go up and cause a stroke. People who have atrial fibrillation with certain risks, we put them on a stronger blood thinner to prevent that blood clot from forming. So if you have atrial fibrillation, you need to know that. After that, we have carotid artery disease or vertebral artery disease. So we have 4 main blood vessels on the neck. There are 2 carotids in the front. There are 2 arteries in the back. They're called vertebral arteries. Narrowing in these arteries can lead to stroke. People don't have to go just check these out if they don't have any problem. But if somebody has a stroke or a TIA, then it's important to get these arteries checked to make sure that you don't have any narrowing and that may have caused a stroke. If the narrowing, for example, is in the carotid artery, and if you have the stroke in that area, it's important, if the narrowing is bad, to get that fixed via surgery. That's, for example, carotid endarterectomy. It's a great surgery, can clean that up and remove that blockage. Or we can go in and put a stent to open up that blockage. After that, sleep apnea is very important. If you have certain risks for sleep apnea, it's very important to get it evaluated and have treatments like a mask to help with the sleep apnea. And then drug use, heavy alcohol use, and other important things that we have to focus on. Some people have blood clot disorder, for example, they're on blood thinners. And then there are others. If anybody had a stroke, ischemic stroke, we usually put them on some sort of a blood thinner. It depends on what the risk is, but having a blood thinner on board, having a cholesterol medication on board, having a blood pressure control is very important. Lifestyle, again, is very important. Routine exercise, eating healthy are the things that really we need to focus on. Other than the lifestyle, obviously you have to know your risks that we talked about, and those are the important things. As far as stroke goes, stroke again is very common in the United States, especially in the southeast area. We have a high rate of strokes. So I advise everybody who know about the risk of stroke and heart attack, and if you have any of those, please seek attention. With that, I would like to thank you for tuning in. Please ask any questions, and our team here is to help and take care of stroke patients. We are very passionate about stroke, and we like to help as much as possible to people prevent a stroke, first of all. Second of all, to provide stroke care, because like I just mentioned, there are ways that we can reverse some strokes. And so we're very passionate to provide this care to as many as people who need it. So with that, I especially want to thank our team and hospital, all the team members who care for patients. They do a great job, and I hope that this was helpful. And with that, I would like to thank you for tuning in, and you have a great rest of the day. Thank you very much.